All right, so here we are, and Laurel is now lying on her side. She's on her left side, and she's cushioned by the pregnancy cushion underneath. So the lower half of the cushion is supporting her pelvis, and the upper part is supporting her upper thoracic and her head. And then her arm is down the center of the two cushions. So she's finding that very comfortable, and I have done this non-fancy draping job here so that you could see most of her leg, and I would just be adding some sort of external thigh and up into the hip kind of massage. I'll be doing some effleurage here with the fractionated coconut oil, just applying the oil in effleurage strokes to the front and the leg. Now remember, if your pregnant patient is in a situation where her bump is so large that she can't lay on her belly, then you would want to do most of the massage in side lying. So you could do, a full, sort of 20 minutes or so. If it was an hour-long treatment, you could do 20 minutes or so in side lying on one side, 20 minutes on the other side, and then maybe 10 minutes, 15 minutes or so on the back, just to sort of finish off. You could do some work on the feet, you could do some work on the belly. Those types of things are really good work, especially coming into the third trimester. So again, Laurel is 22 weeks, and I'm just doing some effleurage up into her inguinal area here, just kind of, pushing lymph, pushing circulation, venous return, the effleurage, and just repetitive strokes that are relaxing. Then I'm going to just go here and work around the trochanter of the hip and just kind of like work into that area, because often, that is very tender and the hips get stiff. And so working all of these attachments of the iliotibial band, the tensor fascia lata at the top of the leg on this lateral side, and just kind of like doing any kind of techniques that you could. You could do kind of like a sort of a cross fiber work with the thumbs on the iliotibial band down here to the knee, just working sort of around the attachments. And, just depending again on the symptomology of your client, often the calves can get sore because the weight is anterior, and the soleus at the back of the leg can be that's a postural muscle. And so as soon as the weight starts coming forward on the body, the soleus muscle kicks in and contracts to hold the body upright and stop it from falling forward. So there could be a lot of tension in the calves. And so you're just wanting to do a thorough job of working on the leg. Okay? And this is a great opportunity while you are working into the gluteus area. And now I'm working with my thumbs up into the glute med and into the sacrum, along the lateral borders of the sacrum, and just kind of working those attachments, and all of that will really produce, some more mobility and less kind of stiffness as Laurel, gets off the table, and she'll probably appreciate that. So I'm just doing kind of like a over alternative thumb kneading in that area, and then I'm just taking the effleurage and flushing back in towards the inguinal area that we spoke about before at the front of the top of the thigh. All right, so we've done some massaging on the leg and from this lateral side, and accessed all the muscle tissue up here and in through the glutes and the greater trochanter and the hip joint. And now if I lift up the leg and support it through the knee and just take my arm and rest her leg on my arm, I can actually mobilize her hip joint from here. And I can just make some nice circular motions, and I can support the hip joint moving back and forth, right? And then I can kind of show her that in order to open up her hip joint, what she could do with her pelvis is actually roll it slightly forward, right? So as she rolls her pelvis forward, she can bring her leg back. And as she rolls her pelvis back, she can bring her leg forward. So it just kind of gets that concept of actually walking, only she's lying down. And this is kind of something coming from more the Feldenkrais movement education, but just sort of, trying to reinforce that kind of, there's some action. You can see almost there's some action in her upper body and all the way through her hip and into her leg here. So if she was really tight at the top of her hip flexors here, the quadriceps insertions, or, even into the psoas muscle, then I could work up into the groin and some of those attachments while I had her leg in more of a kind of a stretched position, and I could work in there, and that would also be, very satisfying if her muscles were tight. If someone's sitting at a desk all day long, what can happen is they flex over top of their hip joint, and then the hip joint subsequently is kind of shut down, and as the weight starts building in the belly, then the weight is shifting over top of the hip joint, and you just want to always have just give a little bit of encouragement, for her to pay attention, that she can still, move herself around. Even if she's tired at the end of the day, she could lay down on her side in bed. She could lay down on her side on the floor. If she was doing some yoga exercises on the floor or in a class and she started to get fatigued, she could still, sort of participate to some degree, just doing some very simple kind of full body movement. If she was finding that she was slouching a lot at work and her hamstrings were starting to get tight because she was sitting maybe too posterior on her sacrum and, kind of like rolling back, just like out of, hey, I've only got a couple of weeks to go here. I gotta, kind of, work it out. Then you could actually come around and you could take her leg and you could just kind of do some movement through the hip, and now I'm starting to stretch her hamstring. I've actually got her foot in dorsiflexion here, and I can bring it, and you can start to feel it now, can't you? So, and I mean, depending on what someone's doing during their pregnancy, how flexible they are, those kinds of things. I mean, this is kind of, straining her a little bit there, but, just getting some length in through that hip, right? Just gentle and, working away, working in that context of still being a relaxing thing, but trying to be therapeutic at the same time in terms of, some of the tight muscles and symptomology. And you could work on the anterior thigh while she's in her supine position, so you wouldn't necessarily have to do too much there. And then I would move up and work on her back, and then we're going to do some integrative things between the pelvis and the lower legs and the upper body and the arms.